Uh, Today we have a program, mental health and psychosocial support. And in these services, we want to ask some question. And we have our doctor who have joined the program today. I'm called David Duck, psychologist. Doctor, you are highly welcome. Can you introduce yourself to the viewers?
Thank you so much. It's really my pleasure to be in the program, and I really congratulate you for really doing and coming up with such an initiative. I'm Boy James. I'm a public health and a field epidemiologist. I work for National Ministry of Health at Public Health Emergency Operations Center. And yeah, it's really my pleasure having you. And when we say it of mental health, it's really our concern, because we, the public health doctors, we really take care of the people well-being, and we are really dealing with the general population compared to medical doctors that are only dealing with individuals. So it's really my pleasure, and it's also glad to tell you that I've been also doing initiative of Info for Health, which is now collaborating with Global Youth Forum. And we are really doing health awareness, mental health, and other things. So we are trying to give awareness to people. They need to know the status of HIV. So how do you really protect yourself? And what are the things, the tips that may lead you to mental health shutdown? So these are the things that we are really trying to do, and we are giving the health awareness. So it's really a pleasure meeting you today.
Thank you so much. It seems we are sharing a lot, and we do also a similar thing in our services.
Sure.
I have some few questions that I want to ask,
Sure.
and I wanted to personalize by to ask you directly, and then we would like to hear more from you. And the first question is, how do you personally define mental health and wellness?
To me, mental health, I think, is the state of emotional, psychological, and also a well-being. That is to say, how you relate to other people, your feeling, your interaction with others.
Wow.
So this is how I view mental health.
Wow, thank you. Thank you. Absolutely. Yes, that is very correct. And what does taking care of your mental health look like in your daily life?
Like to me, when it comes to mental health, you can see this place.
Yeah.
It is where I normally spend my weekend. So the view of this, that is really taking good care of my mental health. I look at the nature itself. It's really giving a lot of messages. So to me, I do a lot of things, daily activities that really boost my mental health. Could it be deep breathing? Okay, I like deep breathing. And when we talk about deep breathing, we actually, like, if I'm not feeling well, or maybe I'm exhausted, I have a normal routines, deeply breathing, which I can really do in the evening, or I do before I sleep. Or maybe if I get a chance in the public places, I can also do deep breathing based on my emotional shutdown, or maybe how I go through the day. So I can do a deep breathing. Sometimes I go alone and also do yoga. So
That's
and
good. Yeah.
exercise as well. Yeah,
That's good. Thank you. Thank you. Can you describe a time when you struggle with your mental health and how you manage it?
let me just be very specific. There are many times one can go through a lot of mental health problems.
Yeah, sure.
Yeah, I remember even last 2024 when we lost one of our members, one of our brothers. So it was really so bad. And how I cope up with people is I have to accept that it's normal, and I should also feel that my mental health is very important. So I have to let on, and also do a lot of exercise to also make sure that I forget this, I don't focus on it. So and other thing, everyone knows is during the heat stress,
Yeah.
which is heat wave in South Sudan. So it was really challenging for everyone. To me, when it was really happening to me, I make sure that I go to a very safe place that can protect me from heat wave. And sometimes I lose the memory. I make sure that I feel okay throughout the days, and those are the very, very best moment I find really having a lot of issues when it comes to mental health.
Yeah, sure.
Yeah, and many other things.
Yeah, sure. What strategy or habits help you maintain your emotional balance? What strategy do you use to maintain your emotional balance?
The first thing, like I said before,
Yeah.
one of the best thing that I can really recommend that help me balancing my mental health, emotional, and even interaction with others is really exercise.
Okay. Yeah.
So whenever I find myself that I'm not feeling okay, so I really take a walk, or maybe I do 30-minute exercise,
Okay.
and also deep breathing. These are really strategies that I sometimes use to come up
Wow.
with
Thank you so much. As we are winding up also, I have the last question here for you, Dr. Boy. How do you know when your mental health need extra attention? Like when you are struggling, maybe, I don't know, with stress and, you know, maybe you have faced challenges like before you have described that also when you lost one of the family members, it was really a hard time. Then my question is, how did you know that you really need attention? You really need help?
Yeah. Thank you so much. Getting to know sometime that you are going through a mental health problem, to many people and to myself, is really high noting that even everyone can notice, right? Like, to me, uh, if I go through a lot of stress, which is a mental health problem, there are signs like headaches. Okay, so this is one signal that you know that there is a problem. And to me, I sit sometime, I analyze the cause of the headache. So am I exhausted, and the rest of the things. So secondly, I sometimes feel the loss of the memory, like I cannot remember things well. So this is now to tell that there is a problem. Okay, so all those things, they are the signal that really indicate that you are really going through a lot. Being in the state of forgetting things, being in the state of maybe you're having too much headaches, too much stress. So those are the signs. And sometimes you will feel like isolating yourself from people as well, which is where the interaction with the people really matter a lot. And that is one of the states of mental health.
What can you say to the people, to somebody who is struggling with a mental health issues or problem?
Uh, to me, or to everyone, my message is that mental health is one of the biggest disease that is really killing everyone now, and people are taking it very slightly, which is very wrong. And you can see a lot of people making suicide. Me, when I was young, I was thinking like someone is doing it intentionally, but that is not the cause. And we know that everyone loves himself or herself. There's never been a time that you think you'll cut your life, or maybe you kill yourself. There are things that make you do that. Even you yourself, you don't have a power or control over it. So to me, is that mental health is really a challenging aspect now. One of the biggest disease that is really killing a lot of people. We should not really take it very slightly. We should give it attention, and we should really try to learn on how to come out of it, because it's a deadly and it's having a power to kill you. So things like exercise, we should really consider them and put them into our daily schedule. However much you're busy, really find a time on how to prioritize exercise and also yoga and things like a deep breathing. So also even your nutrition, food, yeah. So you need to take care of all those things because they really contribute, and how you interact with others. So like thing to go to, if you're a Christian, go to church because these are places where you interact with others.
Yes.
You'll get counseling. If you're also a Muslim, do the same. And also to those who are also doing other social events,
Yeah.
you should be attending those social events because they really contribute to your mental well-being.
Yeah.
You'll get to know new things and news, counselings. Really, that will boost you. So to me, let's take it very, very serious, and it's very, very, very important because it's a deadly disease. Thank you.
Thank you so much, Dr. Boyd. We really appreciate you joining us and for your input. Thank you so much.
It's
We
really
hope
my
to see you
pleasure. Thank you.
next
Nice
time.
meeting you.